Ouch. You know that noise. Ow. Ouch. Somebody once told me ooch, but I've never heard anyone actually say it. Those are noises of pain, and pain is what we're talking about today. It's a super fun subject. I think you'll find that pain is directly connected with addiction. Many times we're even introduced to opioid dependence because of pain, because of medical procedures. That can lead to misuse. That can lead to misery. Pain is often associated with misery. How do we deal with pain in a healthy way? How can we deal with it once we get free from opioid dependence, which, while it can cause pain, can also mask it? And we take away that mask, and then we have to find other ways to deal with it. I'm going to talk with Claire and David today, and we'll see if we can figure out some ways to deal with that and deal with our pain. Well, I threw together some questions about pain I thought might be interesting ways to start. I think one of the obvious ones when you talk about opiates and opioid dependence is painkillers, right? That's got to be up on our list of things to talk about, is where people oftentimes get introduced to dependence. What are some of the feelings that the two of you get being very deep inside this recovery and detox process and industry? What do you see with the effects of painkiller addiction and painkiller overuse? What are thoughts you've gathered over the years?
Well, the people that I talked to in the last 2 decades, I have come to the conclusion that, some people ask, why does some people get addicted to painkillers and others don't? I think there's a situational, a timing, and a mental health factor that exists. So, and it's not one or the other, but all of them. I think all of us human beings have moments in our lives of weakness, of exhaustion. And so when the injury occurs and that patient is prescribed opioids, I think it makes a very different, the results will be very different. What time in that person's life, they had the relief of pain, because pain is not limited, for your physical or emotional being. It's actually a mind and body experience. So when you take a painkiller, your body and your mind is affected. So it's unrealistic for us to think that we can, see or treat the mind and the body separately when we're dealing with pain.
Yeah. I've noticed that when people have chronic conditions that they take opiates for, they often display some form of restricted emotion, and sometimes they're even aware of it, even when they're taking them as they are supposed to. They still will notice that it's harder for me to express myself, or there's some emotional difference in the way they function, and for them or their spouse or partner or their kids, that can be difficult to deal with.
Yeah, there is, I think, more than a different emotion. There is a lack of emotion. There is an indifference. There is, somebody that is physically present, but not emotionally present as the ones around them would expect.
Right. I think that's all true. But, one of the things that I've had people report to me just over and over again is that, at least initially, when they take opiates, they feel a increase in energy, a cessation of pain, their nervous system's relaxed, it decreases anxiety, decreases any feelings of depression if they're there, and they feel better overall. And so what I think happens, which is part of the reason it becomes so addictive, amongst many other factors, right? So I'm just talking more on a chemical basis, is that what happens is that if you think about all of those factors, an increase in energy, a cessation of pain, a decrease in anxiety or depressive feelings, it just creates a profound sense of well-being. And evolutionarily, anything that hit all those markers probably registered in the deep brain, not just in the not like, oh, this feels good type thing, but I mean like it hit all these markers simultaneously, and so people, once that happens, it's almost as if there's a process that takes hold deeply, and they never seem to forget about it. In fact, despite everything you guys are saying is right, because as the evolution of the process takes place, that there's a decrease in that benefit. It gets worse. And then eventually it's just sort of sustaining and staying out of withdrawals. And then it goes the other direction where it dysregulates the nervous system. You get anxiety, you get upset in sleep. It causes pain, right? And worse. So, but people don't remember and register that piece of it the way they do that very first part of it, which is such an interesting thing, that the painful part of it, which can go on for years for some people, doesn't get registered like that initial experience.
Yeah, that's what they call, I know in heroin use, they often call it chasing the dragon, right? Trying to recapture that first experience.
Yes.
I know that I had the experience. I hadn't ever taken any opioid-based medication for really my whole life until I had a dental procedure several years ago that impacted wisdom teeth that should have been taken out when I was 18, but whatever. That's a longer story for another day. And they prescribed me these painkillers, and I'd always heard everybody, not a lot of people in my life say, "Oh, I hate taking painkillers. They make me feel sick. I feel out of it. They're terrible." I'll tell you though, I didn't hate taking them at all. I found that I had a reaction similar to what you're saying, which was, even just taking the prescribed amount. And so that was a clue to me. To say, I guess I should be a little careful. And maybe I'm one of those that's like, where's this been all my life? And so I think there are those factors. And if I'm a person who takes it and doesn't like it, and doesn't embrace or feel that rush of relief, then it's harder for me maybe to have empathy for somebody who does, right?
But I think how people feel things, especially, the perception of pain, the narrative that they talk about when they experience the pain is very different person to person. And I think David is absolutely correct of how the memory is so filtered.
So it kind of romanticized in a way, too.
Correct.
Yeah.
Correct.
Well, and I guess if we're talking about pain, we're really talking about relief. And when that's delivered, that by itself becomes pretty psychologically addictive, I would think, the process.
I think it's psychologically, I think it impacts us, the chemistry of our brains. I think, again, it's truly all around experience. And it's so important that people understand that you can't, deal with one and forget the other. It's the patients we see that have been taking opioids for such a long time, how they experience not just physical pain, but emotional pain, is so different, how, not just how they experience it, but their perception, what pain should be, and how should I deal. I mean, I know myself since I turned 50, just, if I sit for a long term or, when I wake up, just getting up and going, it's a completely different experience than I had 5 years ago. And we have a lot of these patients that are on opioid painkillers, for 10 years, 20 years. So their idea of what it should be, it's so unrealistic that it's what I'm saying to you. We need to work with them physically to put the dependence behind them. But I think emotionally, there's so much work just to bring them to the right perception of what to expect from your body, from life, from your emotions. What David was saying in the other podcast about feeling good enough.
And that's a very difficult narrative to change over time, too, I think. You mentioned just the changes that come with age, where we have to change that internal dialogue about pain. With youth, we can kind of get away with believing that pain is just to be avoided, right? As a very little kid, it's like, ouch, okay, avoid pain. Mostly I can. And for a long time, a lot of us, not everybody, but a lot of people can for a time. And that narrative becomes, I hurt, get better. I hurt, get better. Better means no pain or low pain, right?
Right.
And then have to change that because of surgery or age or disability, or to have to alter that narrative.
I know a lot of what I do in talking with, the patients afterwards is really help them sort of recalibrate what is sort of existential suffering as compared to, for lack of better words, neurotic suffering, meaning, what is the suffering that we have to accept as part of our lives? And, and then what do we do about it? And the problem with opioids is they become sort of everything revolves around it. And then you have to begin to pull apart again, what needs need to be met individually in order to feel as well as you can. So, so sometimes people say, I still don't feel good after a while or whatever. And I'll say, well, how much, did you sleep? And they'll say, well, I slept 1 hour. I'm like, well, it's not going to feel good if I'd be bumping into walls if I slept 1 hour. and so then they get to sleep and they're like, oh yeah, you're right. I feel good now. I feel fine now. I'm like, okay. But literally it doesn't even register that, I mean, when I say it, they can recognize it, but it doesn't really register that that's actually, and then there's other causes too, right? And sleep's a significant one that we all need to function okay, but there's many, many others too that stop being recognized. And so, part of the process back to yourself and back to health is just slowly determining what all those needs are and then figuring out creative ways and the best ways to meet them, to reestablish a sense of, well-being and also a feeling that you can affect how you feel again, so that it's not just predicated on this one pill you were taking for a long time, that type of thing.
Yeah, I read a tweet just the other day where someone said, it's almost embarrassing after being an adult for as long as I have, how many times I feel terrible for half a day until I remember to drink a couple glasses of water and feel better. Like this interaction with my own health and well-being in a way that's, well, and it's not as dramatic, right? The intake of drugs can provide a almost heightened or supernatural ability to interact with how I feel, although it backfires over time.
Right, and distorts it all along the way.
People want it now. People don't want to wait. People don't want to feel any discomfort. Everything has become so immediate in your life. You want an information, you find it in a second. You want to call somebody, you call them immediately. There's no more delays. So our patience, our ability to handle discomfort have become really, really small. Well, before we used to take, a Tylenol or an aspirin and wait for that pain to go away. Now we want it to be gone, and we want it to be gone now. And I think that's where pharmaceutical companies make their profits, offering immediate response to their distress. The issue is there is no long-term thought. What this lack of ability to feel any discomfort is going to lead into.
Unrealistic expectations of pain management are essentially a setup then to fall into dependence and overuse.
I would say so. I would say that it was for a very long time. Now, more than ever, pain management doctors are being, screened and, regulated. And so as the prescription opioids, what in some way, somehow, is not fair for those that have been prescribed the last 20 years. They left these people with no solutions, desperate out there.
It's difficult when you get a situation where, like you say, if I've been taking something for decades, and then all of a sudden it's like, let's transition you. I mean, you know.
Oh, it's worse than the transition. These people were told it's over. You're not getting prescriptions anymore, or I will give you prescriptions for another 30 days. And then what?
Yeah.
And it's not that they are not feeling pain. I mean, there is the phenomenon that is like, it is amazing to me that hyperalgesia is something that nobody speaks about. There is so many people suffering from this condition, and is a condition caused by long-term opioid intake. I'm saying, but it is ignored because it's not profitable to understand the condition. Once you understand the condition, then you have ways to prevent from getting this condition.
Yeah. I'm often surprised how few people know about the risks of opioid-induced analgesia when they're first prescribed painkillers, and that no one's ever talked to them about it.
Correct.
I was a counselor for several years before I heard that concept, and I was like, why the hell hasn't anybody told me about this before?
Right? So it's pretty amazing, but sadly enough, it is it's the reality. And most patients that did start taking opioids when it was prescribed mentally for everybody for every possible reason, were not told about it. And when the consequences happened, nobody stepped up and gave them solutions, for those issues. And we still are doing the same thing, by the way. It's not like we stopped doing it. It would just change the name of the opioids that people are being prescribed.
Well, you look back and the evolution of drugs as they move through being invented and then prescribed and then used. You can track heroin, very similar to how we have, opioids in a way are just synthetic versions, right, of the same thing. And heroin was a miracle drug when it was invented. I'm doing air quotes, but you can't see those. It went through the same sort of evolution of misuse and then getting to the street drug level. That's
correct.
That's a question I was going to ask. In your work through Wiseman Method in your clinic, do you see people come in who have made that sort of opioid medication to heroin crossover? I know that's fairly common when they don't have prescriptions.
Yeah, we see that, sadly enough, more often than not, and we see that by people that you would never think possible. And they never thought possible. But again, when they come to such desperation of what to do, there are very few options. But I think more than heroin now is the fentanyl. You can find fentanyl everywhere.
They don't know what else to do, and they end up making decisions that they never imagined they would, and head down, roads that are dangerous and, put a lot of their lives at risk and really don't want to, but don't see a better alternative.
Mm-hmm. I remember hearing a story from an individual who very much is like what we're talking about, would have never thought of themselves as someone who would be buying drugs on the street, but talking about buying essentially black tar heroin. Not to get too specific, I don't want to trigger anybody out there, but learning pretty quickly that it was actually a hunk of literal tar. It was fake, right? The person had sold them, and sitting in the car knowing that they were starting to go through the pangs of withdrawal, knowing that if they went back and said, "Hey, you sold me fake drugs," they're going to probably get stabbed or something in this park. And just that realization, not only the pain physically, but this kind of emotional feeling and realization of, I never thought I'd be sitting here, skipping work, broad daylight, trying to buy drugs, literally crying because of the pain of knowing that this is not what I need. That's a lot of emotional pain.
It's unfair that, because there are so many solutions. There are so many available treatments. There are so many ways of helping people, put these issues behind.
Yeah.
and it's just not accessible to them.
Yeah, and that's a good kind of pivot for us to get into some of the solutions or the strategies maybe that are little on the hopeful side. One thing that I have been impressed when we have these conversations, we always get into a pretty dark place, but I have been impressed by how much we're able to find hope as well. So, we will persevere here. One of the things that stands out to me is that appropriate pain management. So first of all, there's the internal expectations, but also it must be really important following detox and beginning treatment to be finding that realistic and helpful pain management professional, right?
Right. Well, they know. I think at one point they didn't, but I think at this point they know, and they know what's available. Opiates is a kind of drug that the patient's mental health should be considered. When you prescribe a drug to treat a symptom, it's a very dangerous way to practice. I think when you prescribe a drug to a patient based on not just their health needs, but based on their livelihood, I think the risks are less and the adverse side effects will be less. So the question is this person going to leave my office and drive? Is this person have to drive their kids home? Does this person have a depression that was never treated? So all those things, I think, are factors that need to be evaluated and considered before any drug, not just opioids, any drug is prescribed. But that's not what we do. Doctors have less and less time to work with the patient, and they are there to minimize symptoms. And we're paying a very high price for that.
We talk about shifting expectations about pain, and there's a therapeutic acceptance, I guess, needs to happen, right, for people to do that. Maybe my acceptable levels of pain have changed in order to keep me sober and safe, and I'm not seeing 0 on a 0 to 10 for pain maybe anymore. How do people accept that? What kind of things help with that?
I mean, I think there are actually things that can be done to help with that. I know that one of the things they teach at a lot of places is meditation, right? So that the ability to, what pain is in the body, what physical pain is specifically is, a type of intensity and congealing of sensations, right? And so the more that you congeal around the sensations, the more you'll suffer. The less you congeal around them, the less you'll suffer. So even if the sensations don't change, the ability for your brain to relax around the intensity of whatever's going on causes less suffering. So they teach that technique through meditation and mindfulness and other things, and it's a valid process. It actually helps people even when the pain can't be changed or the intensity of the sensations, which is what pain is, can't be altered. You can your relationship with it can alter how much you suffer from it, and that's a real thing. And I think people who I talk to who have chronic pain issues, I really push them to explore that, because part of what happens that causes people to, overuse medications and stuff is they begin to feel really helpless. And they don't have a way to relate or feel like they can affect what's going on. So that combination can create a real sense of overwhelm. So the ability to understand, right, this equation, basically, pain times resistance equals suffering, right? So the less you resist it, right, if you pull a muscle and you get into a jacuzzi, the heat from the jacuzzi relaxes the muscle. And so even though the injury isn't healed, you will suffer less while you're in the heat, just because there's less congealing. So the same is true with the brain. So I think we have to help people understand multiple ways to deal with pain. I mean, especially physical pain. And that's one of the ones I know.
And I think what David is saying is not just positive for physical pain, but I think is all these therapies are incredibly important to minimize emotional pain, this stress, anxiety, all the above, because it teaches you how to respond to uncomfortable feelings, regardless if those are emotional or physical, or show as emotional or physical, not necessarily one or the other. Mm-hmm. So I think people undermine the impact of what these therapies can bring.
That's 100% right. And to what you said before, it also teaches patience. That we actually realize we can wait and we can be with ourselves. And when you can be with yourselves, when you can really be with yourself, and you begin to feel that and know that, you do not have to be so reactive to anything. And it crosses over, like you're pointing out, in a myriad of ways.
Right. We most of our patients do rapid detoxification, so we are able to detox them in the hospital. And I think rapid detoxification has gotten a terrible rap around the world because it's sold as this miracle overnight cure. I'll treat you in the hospital. You go home tomorrow and you're great, and you're going to do fine. Yeah. It doesn't happen. And one of the reasons it doesn't happen is because of everything we're talking about. Mm-hmm. Once the patient is detox, patients have zero endorphins. What that means is they feel things a lot more intensely. They have zero capacity to withstand discomfort because their brain is used to discomfort, opiates, discomfort, opiates. The thought of having a discomfort in 2 hours from now, opiates. So you can't switch that thought from a day to the other. So when we take them, so that's why we built Domus Retreat, a recovery center where we can help them in that week to know that every hour they will feel better. They sleep, they will feel better. Once they start eating and their gut starts working, they will feel better. And all that physiological change makes them emotionally feel wonderful. We have what we call the turnaround day. The turnaround day is a patient that is, there for a couple of days, just dragging and, wanting to sleep and not moving much, to the day that he wakes up and say, wow, I'm feeling pretty good. What that meant is physiologically, he starts working. His body's regulating. And emotionally, he is affected by that, regulation. So again, even the patients that move around, we offer, again, like David said, Tai Chi and yoga and things like this. The stimulation, to their circulation helps the immune function, Yeah. It helps the endorphins come in, helping with anti-inflammatory foods that gives them energy, helps minimize that discomfort. We have to stop talking about people due to a certain part of their lives or a part of their being. Human beings that are tremendously complicated and different and full of functions that, work together as a clock. And when one of them get disrupted, the rest will suffer the consequences. So we got to look at people as human beings, not as chronic pain patients, not as addicts, not as depressed, as human beings with a combination of symptoms, of DNA factors, of whatever. But we need to treat the person and stop treating the symptom.
Yeah, you're right. That's right, Claire. You're not your symptom. The symptom is just information about something that needs to be understood. The idea that you are a chronic pain patient, it's just information about one thing that is happening in your life at some level at a certain point in time. And yeah, something to be paid attention to. And that's got to get sort of put in its proper way of understanding it. And anytime you distort, you create suffering. Okay, so the purpose of therapy and generally is to understand and move out of distortions. So as things are seen well and the system is put into a balance, the distortions can be dealt with specifically, creatively. You can find better ways to deal with them. And as you move the system towards whatever the good balance is for that human being, whatever really works for them well, and you discover that, you put back together and help somebody sort of reestablish a sense of their well-being to whatever degree is possible. And like you're saying, so the symptoms are just information. That's what they are.
And this information, believe it or not, more and more we have, proof that, the cognitive therapeutical interventions actually changes the brain. The effects that it has in the brain, physical effects it has in the brain, can help with the pain experience, with the distress experience.
I see it all the time. When I help someone really understand, so they feel it, something that they're anxious about or concerned about or something they're upset about, and we put it to rest, I will ask them, how's your anxiety right now? And they'll say, it's much, much better. There's a whole physiological response. See it constantly. In fact, that's my job, right? And significantly to understand in a way in which there becomes a felt change. And this has been well known and established. It's fantastic to understand that we can actually, just through knowledge and understanding and going about figuring things out well, that people feel, right? It can't be anecdotal. It has to be really personal and it has to be felt. And then you get the change.
One of the things that's a recurrent theme on our show is that even though you can go through a rapid detoxification, you can't hurry health. The detoxification is one small part of that's kicking off sobriety and health. And I think that's the heart of, like, say, the Domus retreat or that first week, and then that encouragement to continue with good pain management, with good exercise, meditation, possibly therapy, or even family or couples therapy. Well, any of those can be tools that are there, but you need all the tools, right?
That what a rapid detox does, what it's really good at, is it speeds up and limits suffering. Because the pain of getting off of an opiate, if you can minimize it and speed it up, why wouldn't you? Going through it in a prolonged way, I don't see that there's any benefit to that suffering. Now, afterwards, you still have to go through the reorganization process where you begin to identify needs again, and you get the system back into balance. And no matter what method of detoxing or change, that has to happen. But why not limit the amount of and speed up the amount of suffering that is just trying to get you to a different place? That's really what it does.
Yeah, and it's really changing the thing that you made reference to earlier, Claire, when you were talking about we can be in a rush to find an answer, and that's the kind of thinking that can set us up to get lost in addiction. So we definitely don't want to rush into that thinking when we're going into treatment.
No. People have to be very careful of what to expect from treatment. It's not going to change your whole life. It's not going to change your reality at home. It's not going to change, your future. You are going to do these things, and you're going to do these things based on what you get from your detoxification, what you get from your therapy, or whatever mental health assistance you will need. Yeah. So you can't expect to go in, I don't care if it's 1 day, 30 days, 60 days, 90 days, and have 20 years reversed. It's not like that. But it can be really good. It can be really good, but it has your expectations and your willingness to keep on working for your health has to be sustained. And that is on what you eat, how you exercise, how you sleep, how you deal with distress, how you accept emotional and physical pain. So it's an attitude. It's an attitude of health. It's an attitude. Is actually a more than an attitude of health. It's a responsible attitude to your person and to your body.
And we're going to leave it there. As Claire was just saying, not only is it something that you have to do to embrace your treatment, it's also something that you can do. We believe in you. Just by listening to a show like this shows that you have the interest and that you have what it takes to start whatever path you need to start for yourself or for those you love. Anything we can do to help you, check us out at opioids.com for the Wiseman Method Clinic and Rapid Detox Program. You can also call anytime at 1-800-423-2482 if you have questions about opioid addiction. The show, as always, is hosted by Claire Wiseman, founder of the Wiseman Method, and David Livingston, our chief therapist. Our music is the song Medical by Clean Mind Sounds. The Wiseman Method podcast is produced by Pop Color Productions, a company that helps you to start up your podcast, especially if you are a helping professional. Make sure that you're getting help when you need it. Make sure that you're being safe, taking care of yourself. And as always, remember to ask questions. When you ask questions, you get answers. And whenever you can find answers, you can find hope. Have a good week. We'll be back again soon with the Wiseman Method and more discussions about addiction and recovery. Bye-bye for now.